Hello, everybody. I'm Teresa Snow. I'm the Executive Director of Strategic Communications for MU Healthcare. I am joined by Dr. Margaret Day. Thank you very much.
Thank you.
You can only see half of us, but we are appropriately spaced and masked up for this hour or so. We're so pleased that you're joining us to talk about the COVID-19 vaccine. We've got about an hour. We're going to have a nice conversation about vaccine availability, about its efficacy, about what we're doing at MU Healthcare to roll out the vaccine process as we prepare to ramp up and do a lot of people. So we're just so glad you're here with us. Please share this live, share it after the fact so we can get the word out. Dr. Margaret Day, you are the co-chair of our COVID-19 vaccine committee, medical director for our ambulatory services and family medicine, and a professor of clinical and family medicine. So you wear a lot of hats, but your time has been consumed with this COVID vaccine project.
Yeah, it has lately. Yeah, it's been a wonderful thing to be a part of.
Let's go straight into the presentation so you can tell us a little bit about where we're going today and some of the topics that we're going to be covering.
Yep, absolutely. Excited to have this opportunity today. So just wanted to give a roadmap, talking today about the distribution process for the COVID vaccine, its safety and efficacy, who's eligible, and then covering some common questions and concerns regarding the vaccine as well. And just want to make mention, of course, of our website at muhealth.org/COVID-19 vaccine. It has a lot of answers there and is a great place to get up-to-date information about the vaccine.
We have received some of your pre-submitted questions, and we appreciate that. A lot of them are very customized to specific situations, but it gets us an idea what the questions are in the community, and we'll be watching the questions as they come through. That vaccine page is a great place where in the future we can also add questions and answers to your commonly asked questions. So if you don't get an answer today, we'll look to do that. But we have plenty of time. Let's go into your presentation.
That sounds great. Absolutely. So covering first, talking about the distribution process. So many questions we received ahead of today's Facebook Live are regarding when can I get a vaccine? And, of course, an appropriate and timely question. And so just want to go over, we are certainly adhering, very strictly to the Missouri guidance here in terms of phases of distribution for the COVID vaccine. So certainly listing here, as you know, phase 1A is the group of people who we've been vaccinating now for the past several weeks. And that includes long-term care facility residents and staff, patient-facing healthcare workers, and then EMS, paramedics and things. And then just very recently, the governor on the 14th put us into the phase 1B, tier 1, so covering people like first responders and emergency services. Then on the 18th in Missouri, tier 2 of phase 1B with high-risk individuals by age or their medical conditions were added into the people that are ready to go in terms of receiving those vaccines. Tier 3 of the phase 1B, that date is still to be determined in terms of immunizing critical infrastructure workers. Same with the phase 2 and phase 3 populations there that are on the slide. Not yet going live on those, but again, at MU Healthcare, we are really following the state's guidance, and so looking for the soonest opportunity to be able to move in concert with that and be able to distribute those vaccines to the phase 1B, tier 1, tier 2 people, while still catching those who fall into phase 1A but haven't yet gotten an opportunity.
So I think this leads to a lot of questions, which is I hear in another state they're doing something different. I hear so-and-so got it and they weren't in this phase or that phase. This is somewhat unique to not only states, but local communities and health systems like healthcare.
Yes, it is. The federal government really gave states a lot of ability to, make a plan that's most appropriate to their specific state. So you may hear of other residents in other states having very different, plans or tiers of individuals, and that is kind of according to plan and how this has gone. So certain local, vaccine efforts, as well as, kind of on the county level, are very specific to those locations.
So if we know we can vaccinate all those people that has been opened up, where are we as a health system in that that process. Who are we doing now?
Yeah, absolutely. So we've had a lot of success here. We are proud to say that we've immunized, well over 5,500 individual employees at MU Healthcare with their COVID-19 vaccine. And so we are in the phases of now getting those initial recipients their second dose because we've received the Pfizer product. We need to give that second dose 3 weeks later. So efforts are ongoing in phase 1A to get our healthcare workers immunized.
You mentioned our employees. I think someone asked a question of, are employees getting it? Thinking if employees didn't stand up to get it, why should they? But we've seen our employees step up and sign up.
Absolutely. Yep. We have a dedicated COVID-19 vaccine committee that's been working for months to make this effort happen. And, some initial discussions included, what is the uptake going to be like? How do you plan? Should we expect, half of our workforce to not want to get the vaccine? And that just couldn't be further from what we're experiencing. We have a lot of demand, a lot of uptake, and we're excited to be able to successfully give those.
And to clarify, we don't mandate it for employees at this time.
That's right.
They have stepped up.
Yeah, absolutely. It's not mandatory to get the vaccine for our employees, but they are just really, encouraged to do so, of course. But yeah, they have been very willing, and most of the questions that we're getting and fielding from that vaccine committee certainly involve, when will it be my turn?
Yes.
Just like we're hearing from our patients and community now as well.
So who is the next group, I should say, that we will be vaccinating through MU Healthcare?
Yeah, so next week we have a really solid effort here to vaccinate our clinical learners. So medical students, nursing students, therapy students, people in the School of Health Professions, and those instructors as well. We are working on vaccinating some folks in law enforcement as well. And we're also providing opportunities for people who are, healthcare providers but don't necessarily work at MU Healthcare. And that can be a challenge to find a place to get your vaccine when you work in a smaller practice, say a smaller dental practice or a smaller medical facility. So people who clearly fit into the 1A category who just haven't gotten an opportunity yet. We hope to serve that need next week.
You mentioned clinical learners. These are people who are in our facilities, working with our patients, and as part of an academic health system, it's part of our mission to teach.
Yep, absolutely. So that has been well planned, and so the doses that we have on hand right now are going to that, like I said, second dose for our 1A workers, and for this effort next week, which has been well scheduled in advance and planned, and so we have a good plan for those doses that we do have currently.
So those folks who are watching and they're in that next tier, and we haven't sent them a note or said, here's where you can sign up, where you can go. When can they go?
Yes, I know. We are as enthusiastic as anyone to be able to start offering those opportunities to folks. Couldn't come soon enough for us either. But, we are committed to doing this right and to doing this well. And so just, knowing that there's a lot of unknowns about the COVID vaccine, and one of those is the amount of vaccine that we'll receive. And so we want to be, perfectly reassured that we have the vaccine in order to meet the need, and would hate to invite people to receive their dose and then not have the vaccine to be able to provide. So we're feeling very confident that we are setting up opportunities for the public to have lots of opportunities in the coming weeks to be able to do that. And I think the only limiting factor there will be how much dose will we receive.
So we just don't have the doses yet to invite people and say, come get your vaccine.
Exactly, but we're ordering every week, and so we're optimistic that this is going to be able to be offered to our community and patients here just very soon, here in the next week or two.
You mentioned inviting them. We have a survey form, and you can go online. How will I know when it's my turn to be vaccinated? You can go to muhealth.org/vaccine-survey. Now, this is where you fill out a survey and you self-identify that you are in one of these groups. This does not put you in line. The first person who signs up is not the first to be vaccinated, but it does give us a way to reach back out to you and have you sign up for a time to get your vaccine.
Yes, that's exactly right. By filling out this survey, it's very similar. There are other surveys being stood up too. Boone has one now, I think, and the health department does as well. And, you know, the real main focus of that is to let us know of your interest. Let us know your contact information so that when we are ready, we have your vaccine, we're able to reach out to you. You can make an appointment and come get your vaccine without, pretty seamlessly.
So why appointments? You know, we don't have appointments at the drive-thru to get your nose swabbed. People have waited for hours for that. Why appointments?
Yeah, absolutely. We think appointments are going to be vital to this vaccine effort. And that is in part because of some logistics in storage and, some specifics to that Pfizer vaccine in particular. We expect to keep receiving Pfizer vaccine from the state for the foreseeable future, though certainly we'll accept any vaccine that arrives. But specific to that Pfizer vaccine, it has to remain in ultra cold storage, and so a lot of planning needs to go into making sure we get that vaccine out at the appropriate time in the appropriate amounts, let it thaw, and then have it available for people at specific times in specific quantities so we don't waste doses and we're using that resource that is precious the most efficiently.
Yeah, you thaw too much or you thaw too little and you have people that are upset.
Yes, and we certainly don't want people waiting 3 hours for the vaccine to thaw or, having leftover at the end of the day. So that by appointment is very important. Not to mention it's just vital for social distancing efforts. We do have to remember the pandemic is still going, and so to be able to keep, safety and maintain that distance, appointments, I think will be very helpful.
I will let you get back to the slides in a minute, but I'm going to stay on this train and say, where will those public vaccination clinics happen? It's going to be on the MU campus.
It is, yes. Just, recently announced here that the Walsworth Columns Club here at Memorial Stadium, the east side of Faroe Field, will be the place that MU Healthcare is going to set up here for the mass vaccination events. And that will actually be in play just as soon as next Monday. So a lot of preparation has gone into that, and we feel just really good about its likely success here.
And we say in play, we'll be doing the vaccinations for those clinical learners and the other groups we already have scheduled there so we can see the flow of traffic, traffic, and then when we open it up to the next groups, we'll know how it goes. I know our team is charged with the website and the Facebook and those kinds of things, and they're doing a run-through tomorrow on how's it going to work, where are you going to park, how are you going to get in. The Columns Club is actually one of the suites that's above the football stadium, so when you get up there, you have a beautiful view of Faroe Field, but you're there for a purpose, and so we'll be able to show you where you park, how you get in, how you take the elevator, how many steps there are, because we know people are concerned about accessibility, and we're not talking about fighting student traffic to get into a clinic that's life-saving.
That is exactly right. And there is an elevator, so that is helpful. It is on the second floor, but there is accessible elevator. And I know a lot of thought is going into making sure that, should you need a little assistance or an escort, we want to make that available too. So we don't want the location in any way to be, something that keeps one from receiving the vaccine.
You just handed me some more questions, which are ones that I knew we were going to ask, and I see that people are asking them as well. Thank you so much for joining us for this Facebook Live. Dr. Margaret Day with our vaccine committee. She's a family medicine physician as well. Will there be an option for homebound individuals? Trying to say how easy it may be to get to the football stadium, on the MU campus, but for some that really won't be an option.
Yeah, absolutely. And we are sensitive to those needs as well. A couple things. MU Healthcare certainly isn't the only player or the only provider for vaccines. And so sometimes folks will find that the health department or a different route, a pharmacy, for example, is a better option for them to receive a vaccine. We look, of course, to meet the needs of the community and look for opportunities in the future for perhaps different venues or different reach out efforts or that type of thing. I think, it's very promising that additional manufacturers of vaccines and different types of vaccines are on the horizon. For example, Johnson & Johnson, AstraZeneca appear close to seeking emergency use authorization, and they are not quite as fussy when it comes to the vaccine storage and handling, and maybe a little bit more apt to be able to take the vaccine to people as opposed to people really having to come to the Pfizer one. So we're certainly thinking through those things too.
Yeah, stand by. Your experience, you had the vaccine, you were one of the first as you're critical to operations of the health system. Tell us about it.
My experience was good. I received my first vaccine, had a sore arm, really kind of right away, to be honest. It lasted for a couple of days, felt very much like a flu shot, and really kind of otherwise was without incident, and then received my second dose 3 weeks later, and was just fine. Again, kind of a sore arm, and that was about it.
So how long after that second dose? You had the Pfizer vaccine, which is how many days between doses?
21.
21 days. I was going to say 21. You had the Pfizer first time and second time, which is what's recommended, that you stick with the same company. How many days after that second dose before you're as fully protected as the vaccine can do?
So the Pfizer phase 3 trial looked at people after day 7 and started counting how many are getting sick from COVID infection versus not. And so it's thought to be about 7 days after the Pfizer vaccine. The Moderna started counting about 14 days. So somewhere in there, 1 to 2 weeks after you receive your second dose.
I had a question of could you request the Pfizer or the Moderna? Right now, we're only getting the Pfizer vaccine.
So yes, right now at MU Healthcare, we're being routed from the state the Pfizer vaccine. Moderna is out there, certainly at different, pharmacies or different locations. So I think the state is just carefully distributing whatever's available to the most appropriate venues.
So I want to go back to your presentation because we talked about the phases. And I think we could go back to the slide 4 where we talk about the phase 1A and phase 1B and let you just further explain who is getting it and in what order.
Yeah, you bet. This is a busy slide and we don't have to go over maybe every word here, but we just wanted for your reference. This is again, phase 1A by the state of Missouri and who fits into those categories. And this is the one that has been in play from the beginning in terms of people being able to receive those vaccines. And then this is just a detailed listing of the phase 1B, tier 1. So those first responders, emergency service, public health infrastructure folks. So this announcement starting on January 14th by the governor is what prompted us to be able to work with, for example, MUPD and invite them to come in and get their doses here at MU Healthcare. So first responders, folks working in public works agencies, examples listed there. And then I think this one is also worth discussing. So this is phase 1B, tier 2. So high-risk individuals by age or with the following chronic conditions. And I know this has been a source of many questions that we've received.
Yes, we've gotten a lot of questions about I have this or that, or I'm in this situation, I have asthma, I have diabetes, cancer. Like everybody has a different situation, and it's hard to put them into a box like this.
Yes, it can be. And I will say the list is a bit different than the maybe first published list before this phase went live from the state of Missouri. So I think that has generated some questions as well.
Oh, yeah, pregnancies on it. And initially we were, you deliver babies, so you deal with this question quite often.
Yes, exactly. Yes, so one of my pregnant patients asked me specifically, and then I had to tell her, oh, things changed after the 14th. So definitely good to revisit this list, as I think some expectations were changed with regard to this most recent version. And so I, again, would just highlight that at MU Healthcare, we are, contracted with the state of Missouri and plan to really follow these phases in tiers perfectly as well as we can and not veer from those. And certainly can be difficult when I'm fielding questions from my patients. These are the ones that I'm getting every day when I see them in clinic or field messages through the portal, for example. And we are really going to stick with these recommendations because we want to be able to continue to receive vaccine and be able to maintain that good relationship. And so that's the most current list of age and medical problems that we'll be sticking to.
Big question, are the coronavirus vaccines safe and effective?
Yes, absolutely. I know this is also very, very much on people's minds. So what we do know is the Pfizer and Moderna vaccines, they're both mRNA, so messenger RNA vaccines, and they've both received emergency use authorization from the FDA. Like I mentioned earlier, we may be looking at some different types of vaccines that aren't mRNA. They're actually viral adenovirus, more traditional perhaps vaccines coming in the near future, but so far these are the two approved. And so we've talked about the Pfizer dose. You need to get 2 doses, 21 days apart. And the Moderna vaccine, you also need to receive 2 doses, and these are given 28 days apart. It's very important to follow through with receiving your second dose of vaccine. So the second dose is where this 90 to 95% efficacy comes from in the phase 3 trials. Receiving 1 dose probably does offer you some protection, and it's, one of the things we'll learn about here as the vaccines are given kind of in real-world conditions as opposed to the study conditions. But the Pfizer paper published that about 52% efficacy after receiving the first dose. So you can see that receiving that second dose is really important.
We know that shifted a little bit. We were initially giving everyone that we have given vaccines to has had 1 dose and then the second dose. But now the recommendation is go for the first dose, give as many people the vaccine as you can, and do clean up with the second dose.
Yes, I know. We have been talking about that strategy a lot. And right now, the federal and state governments are really pushing for vaccine administrators here, like MU Healthcare. When you receive doses, by all means, just give them to the people who are ready. And so we do not plan on really kind of holding back or storing doses that could be used for a second dose 3 or 4 weeks later, but instead administer all we have, and we're going to have faith in the process of manufacturing and distributing to be able to give that second dose when we're ready. But I think that is important for people to know that we want this to get out as fast as possible as well. And so there unfortunately is some risk, that 3 weeks later when you're ready for your second dose, it may be a bit delayed, but I think that's unlikely given the pattern and the cadence that we seem to be on right now, meaning when we request vaccines, we have been, receiving them for the most part. So I think that we're feeling optimistic about that.
Start giving the vaccines and we get more. Yeah. So I had somebody ask, will the second appointment be set up at the time of the first dose?
Yes, that's exactly right. So we do want you to look ahead at your schedule and be, in town and available 3 weeks or will get Pfizer. So 3 weeks after you receive your vaccine, just to make sure that your next appointment is set up, and 21 days later you receive your dose. It really works best that way. We would prefer not really any, 20 days or 23 days, but if you can make it 21 days, that follows the recommendations.
And for our employees, they got a card, got the first one. Before you even got the shot, you had the second appointment made on your calendar, got the second shot, brought back that form that said, I got the first shot, here I'm ready for the second. So it was scheduled. Someone's asking, I'd like to be close to medical care when vaccinated in case I have a reaction. Our employee clinics had a row of chairs appropriately spaced so that after you got a shot, you could sit and wait. I saw our people get back to work, so I don't think a lot of them did that, but will that be available?
Yes, absolutely. The observation period for 15, or for people, who are more concerned or have a history of a bad reaction to a vaccine or something in the past, a 30-minute observation period will be available to everybody. So that's an important piece of this, and we have, trained medical professionals on hand, of course, and we'll be ready to handle any, kind of emergency that might arise. But absolutely, we want everybody to have that opportunity for an observation period directly following the vaccine.
Close to medical care. Okay, I've got some questions on who should get it. Will we be guaranteed a second dose? So we said we are hopeful that we'll have that.
Yes, absolutely. And right now, like I said, we're very optimistic that second dose will be ready and available to you. That's based on everything we know here.
Will I have to pay anything for the vaccine?
The vaccine is free. The vaccine is free. For those who are insured, there is an administration fee that might be charged to your insurance company, but there's no copay, there's no out-of-pocket expense, and cost should not be any factor in whether or not you receive the vaccine.
Somebody says, I signed up online with the Boon County Health Survey. Should I sign up for MU Healthcare's survey also? I was on a call with the health department this week, and we said people are shopping around, they're signing up for all the surveys. One thing I can tell you is that if you sign up for our survey, we will be able to directly communicate back with you. We're talking with the health department whether we should merge those lists so we can communicate. But we're going to be able to tell you about the vaccine we have. Sorry, hitting my mic. We're going to be able to tell you about the vaccine we have with that survey, correct?
Exactly. And there's really no harm in completing both surveys. It's fine. We certainly don't turn down a vaccine if you're offered at one place or another. The collaboration between agencies has been fantastic, and we're all moving toward the same goal. We want people to be vaccinated when they want it. We want them to be able to get it efficiently and safely. So by all means, it's okay. You might get contacted more than once, and that's fine.
Yeah, and you mentioned the collaboration. I know within our teams we're collaborating with Boone, we're collaborating with the health department, we've collaborated with SSM, Cap Region is part of our group as well. So there has to be that collaboration because this is not a competition. This is a community health effort.
Yes, absolutely. And collaboration is how the vaccine was made available so quickly in the first place. So we want to keep that, sentiment going for sure.
Will MU Healthcare only vaccinate Boone County residents, only MU Healthcare patients?
No, you don't have to be an MU Healthcare patient to receive the vaccine with us, and you do not have to be a Boone County resident either. So we are, really taking this on as a community effort, and want to serve our 25 county service area and people who are enthusiastic about getting the vaccine. Yeah,
I would say we would prefer to serve our 25 county service area rather than having those traveling from other cities outside our area, but this is our mission.
Yeah, that seems like a challenging thing for people who live farther away, especially since it takes 2 trips. So I'm sure there will be opportunities closer by too.
Okay, so let's move on to our vaccine Q&A. They were made quickly. How can they be safe?
Yeah, this has been a common, I think, reason people might be hesitant about the COVID-19 vaccine. Certainly has been a repeatedly asked question in my clinical practice. And I'm confident in telling you that this has really been an unprecedented global collaborative effort to quickly develop vaccines. The mRNA technology is new. There is no doubt about it, but it's been previously studied actually for about 10 years in viral diseases and cancer treatment research. And so it really was poised to be able to meet the need. When we had a global pandemic and we needed a fast vaccine, mRNA vaccine technology was, quickly implemented because those who study it know that it was the best bet to get the fastest vaccine safely. So, the typical vaccine from idea to in your arm process does usually take years, and so it has been much faster than that with the COVID-19 vaccine. But I feel confident in telling you that the safety evaluation of the COVID-19 vaccine has not been the place that has been really sped up or been rushed through. It has been the again, collaboration, the large amount of monetary support for this effort globally that has really helped it move along. So really kind of unprecedented manufacturing and distribution as far as that goes. So really rigorously tested for safety. The same kind of FDA approval processes and phase 1, 2, and 3 trials and that sort of thing. So that's one of the reasons why it's just been so quick, but didn't compromise safety in the process.
We had several people ask, what do I recommend in telling a friend or a family member who isn't believing in the science, just the rumors? I want to say, share this Facebook Live and tell them to go about 33 minutes in and the doctor explains it. But yeah, these kinds of things help in explaining to folks the science.
I think so too. And, I think our first steps really should be to try to understand, to listen. I think everybody comes from their viewpoint from a real place, and being able to just listen and empathize and try to understand why, some of that hesitancy exists is the first step. And, really kind of getting people to trusted sources of information, kind of highlighting successes in the past. Polio vaccine, for example, is a just huge success in vaccine history. And, always leaving the door open too. Maybe right now is not the right time, but it doesn't mean that at some point, that person may be interested too. So providing resources, leaving the door open for future.
Let you continue on this as I read some more questions.
Absolutely. So wanted to point out too that, there is a concern, well, what about reactions or side effects to the vaccine? And, it's really important to note that reactions are very similar to the flu shot. But I will note that reactions are known to be stronger after the second dose. And so that's well shown in the trials. The Pfizer and Moderna trials are very similar into their side effects and amount of time that happened to people. And we found that at Immune Healthcare too, that the reactions are stronger after the second dose, even fever, headaches, joint pains, muscle aches, etc. It is most common to get a sore arm or redness at the injection site. That's by far the most common side effect that people have. But I want to point out that serious side effects, serious adverse events, serious reactions from the vaccine are very rare. So look at that less than 1% in the vaccine group and in the placebo group for Pfizer. And then right about 1% in both the vaccine and placebo groups for the Moderna vaccine. And in reading through the paper, the side effects are kind of unexpected, and you wouldn't really attribute them necessarily to the vaccine. It doesn't make sense. Some of those side effects, in 0.2% of the people or that sort of thing was like a gallbladder problem or a heart attack, and it doesn't really make sense that it would be from the vaccine. But serious things happen in very small amounts of people.
So there's a lot here. What is the most significant on this slide?
Absolutely. So really what we're trying to show is this is the reaction down on the left, and then the COVID vaccine dose 1 in the next column. And this is the percent of people who had these reactions to the vaccine. And then you can see that almost all of those effects go up when they get the COVID vaccine dose 2. And then we put the influenza vaccine adverse events on the far right, just to give you a comparison and show you that the reactions are similar, but notably, fatigue, fever. So, impressive to point out that 15.8 of people after their second COVID vaccine will get a fever. So that doesn't mean that you got sick. It doesn't mean that anything unexpected happened. This is all evidence that your immune system is reacting to the vaccine and doing what it's supposed to do.
Kids get their vaccines. When you take your young child in to get their child immunizations, they want to sleep a little bit.
Yeah, absolutely. So really similar for us, and wanted to point out that that's a very expected and normal reaction.
I just want to make sure I'm reading this right. So the first one is the injection site pain. So if we compare it to a flu shot, we can go, okay, it's about the same as a flu shot. Maybe it hurts a little bit more. And then we go to fever, and we say, well, we might likely have a fever after the second dose, but probably just a little bit more than if you ever had one with the influenza. Fatigue. So that's kind of how you're comparing. You're just going, headache, well, I probably 21% got a headache with the influenza, maybe a little more likely to have a headache with this, and it moves on. And actually vomiting, GI symptoms are more prevalent with the influenza vaccine. I see that.
That's right. Yep, that's right. And I want to point out too that these reactions from the vaccines are much to be expected in the first 1 to 3 days after you get your shot. And if it lingers longer than that, or you experience things like cough or shortness of breath or sore throat, that's not an expected vaccine reaction. And we are still in a pandemic, and you should consider getting evaluated for an infection.
What if you have the first dose and you actually have symptoms of COVID between the first and second doses? Should you delay getting the second dose?
Yeah, this is a really common question too. So, questions about what if I become ill with the COVID-19 infection, for example. And it is recommended that you delay the COVID vaccine, either the first or the second dose, until you meet the criteria to discontinue your isolation period. So that means your symptoms are getting better, you've been isolating for 10 days, etc. There's some recommendation, by the CDC that you probably have some antibodies still for about 90 days after a COVID illness or after a natural infection. And so you could consider delaying your COVID-19 vaccination, for a few months after the infection because of that immunity that you likely are to, carry through for about 3 months after you've been sick.
It kind of raises me to a question, and we're going to talk more about specific cases coming up, when, who should get it. But do they need to call their doctor first and say, should I get the vaccine?
Yeah, I would encourage certainly people to have decision-making discussions with their doctor if they're not sure. But I would encourage too, there's plenty of places to do some research on your own and good reputable websites, the CDC being one of them for sure, our website being another, the State of Missouri guidance as well. So certainly lots of information out there that can help guide people. But yes, if you're not sure, that decision making with your doctor for certain circumstances is always a good idea.
But for most of us, we're just going to go get the vaccine, and we don't need a doctor to sign off or refer.
Right. We have a good slide. If you don't mind advancing us to 15, that would be great. And so this speaks to some special populations and may answer several questions about, but if I have, for example, allergies to medications or or previous, injectable medication, or I have certain food or environmental or, insect allergies. Should I get the vaccine or not? And so you can see the green column here, may proceed with vaccination, covers most allergies in terms of, people who haven't had previous anaphylactic reactions or that sort of thing. So I think it's good to note too that, people who are immunocompromised for whatever reason, your medications or your medical conditions, people who are pregnant or lactating, all are in the may proceed with vaccination there in the green box. I know there was a lot of uncertainty there at first about pregnancy and lactation specifically, and so important to point out too, this is from the CDC, and certainly the caveat here is that pregnant and lactating women really weren't studied in the trials, but most professional organizations and the CDC are saying, if you're unsure, have a shared decision-making discussion with your doctor or your other providers, but certainly okay to proceed from the information we have right now. And then you see certainly the observation periods for different groups as well. But I would point out really kind of over to the red column, the only absolute contraindication, do not give this vaccine to someone, is that you have had an anaphylactic reaction to the COVID-19 vaccine or its components.
Oh, so you've already had it, yes. So I had a question, is it safe if I'm allergic to penicillin?
It is, it is.
Does it contain aluminum or stem cells?
Yeah, I don't pretend to have the list memorized in my head of exactly what's in there, but no, it doesn't have stem cells, it doesn't have aluminum. It really is very basic. It has protein, and it has some saline, and it has a bit of solution to kind of keep it preserved. But there is certainly publicly available lists of the components in that vaccine. Really, to my knowledge, none of them are known to be highly allergenic.
I'm getting a lot of questions, so I'm gonna rapid fire give you a few here, and if you can't answer them, we want to make you an expert in the area that you are. If someone had a reaction to another vaccine, is it safe to get this one?
It is. It is. Depending on what that reaction was, if you had difficulty breathing or you had any respiratory problems with that, you at minimum need to plan to be observed for 30 minutes after you get your vaccine. Other certainly options are to discuss it with your allergist or to discuss it with your providers, but it is okay to proceed with getting the vaccine.
You showed us the efficacy between Moderna and Pfizer. Someone's asking, are they equally safe?
They are. We have mostly Pfizer information here on our slides. I acknowledge that, but they really are. When you read about the phase 3 trials for the Pfizer and Moderna vaccine, sometimes I find myself trying to remember which one I'm reading because the reactions are very similar.
What if I have symptoms after the vaccine? Am I contagious?
You are not contagious. So this vaccine is giving you a piece of mRNA. It's a piece of protein code, for example, and so there's no way that it can give you the infection, and then there's no way that you can pass that along then to anyone else.
So that fever is not a contagious fever, it's a reaction.
Exactly. That's your immune system powering up to be able to protect you into the future.
Will the vaccine work for the new COVID strains seen in the UK and the US?
Yes. As far as we know, the viral mutations are expected. That's what viruses do. So hearing about this mutation really isn't shocking, and we'll hear more mutations coming up in the future too. So, we'll kind of hold the manufacturers responsible for ongoing testing and following up on that, but we have no reason to believe right now that we're not effective in these vaccines against those mutations.
Don't wait for the next vaccine, get this one.
Yeah. Mm-hmm.
Okay. Should I worry my immune system is not revving up if I did not have symptoms after getting the vaccine? Should you worry if you don't have symptoms?
Yeah, absolutely. That's a really good question. You know, we have found that younger people, so the study groups broke down, you know, between those 55 and younger and 55 and over. And very consistently, people in the 55 and older group did not have as many symptoms after their vaccine. So it does have something to do with how strongly your immune system is able to respond, and age is a factor. So you shouldn't worry, but it is something you could expect.
I'm going to keep going. Are there studies in progress for children under 16 receiving the vaccine?
There are, yes, that's right. That so the Pfizer product is approved for people 16 and over, the Moderna for 18 and over, and there are ongoing studies for children in younger age groups. So I think we'll probably hear most, quickly about the 12 to 15-year-old age group next, particularly for the Pfizer product. But I expect it'll still be a while before we hear about younger kids.
Yeah, we had a question, can toddlers receive the vaccine? So we're really talking about that 16 and over group. Are recipients required to sign a waiver when getting vaccinated?
Yeah, there is paperwork to sign. I'm not the expert there for sure, but I know there are consent forms, there's, information to review ahead of the appointment, and, consent to kind of acknowledging that you fit into those tier categories and, self-reporting correctly involved.
Yeah, I know we've had questions of, do you have to prove it? You will have to sign an attestation, if I said that right, where you're saying, I am agreeing that I'm telling the truth about where I fit. Yep. And so think of your fellow man and tell the truth when you step up for the vaccine. Exactly. Do I have to ask my doctor before getting the vaccine? And we said no, unless you feel anxious that you're in a special category and you need to check on
exactly.
that.
Yep. And in most part, I can share with you that the vaccine right now will not be able to be given in clinics and will not be administered by your provider like we have been used to, with a lot of other vaccines. And so really the most efficient, effective way is through the ImmuHealthcare website, completing the online form and getting your information that way. That will be the most up-to-date, most efficient for you way to get information.
I'm not sure we have an answer for this, but will you have a call list for people to get the vaccine if a scheduled person doesn't show up?
Yeah, we don't yet have that process worked out, but it has been discussed for sure. So right now I'll say I don't know, but we do plan on not wasting a drop. So we have wasted 0 doses at ImmuHealthcare here in our 8,000 plus vaccines that we've given. And one of the ways to do that is by planning ahead and making the appointments and knowing, how much volume we'll need for the day. We also, though, have found early on, of course, the demand for the vaccine is very high, much higher than the supply. And so we are committed to not wasting, and we'll have processes to not do that. I will note the vaccine is okay in the fridge for a few days. So if we end up with a vial that became thawed, it won't go to waste. And so thank you for that suggestion. We'll take it into account.
Can we move on to slide 17? What are some common myths? Because I think some of these might answer questions we just got. Question 1. I've already had the COVID-19 I've already had COVID-19. Do I still need the vaccine?
You do. We recommend that you get it. A bit of additional information here. Like I said before, you need to wait until your isolation period is over to receive the vaccine. You might consider waiting 90 days after your infection due to probably lingering immunity from that infection. But we definitely recommend that people get the vaccine, get it when it becomes available to you in all practicality. So.
Okay, next one. Question 2, do I still need to wear a mask and social distance after I receive the vaccine? You've had it, you're still wearing a mask.
Yes, you do. You need to keep wearing a mask. And that will be ongoing, I predict, for months and months, unfortunately. So I know that is not the answer most want to hear, but yes, you need to keep doing all the infection prevention strategies after you receive your vaccine.
Does mRNA interact with my DNA?
Nope, never. So the mRNA goes into it's what's called the cytoplasm of your cell. The DNA is in the nucleus of your cell, and so they never touch, they never interact. mRNA is the thing that is the protein's instructions, and so it's telling your cells to make something that looks and really kind of is the spike protein of the coronavirus, not the whole thing, but just the piece, the little spiky things off of it. And that's how your immune system will see it and make antibodies. So it doesn't interfere with your DNA. And that RNA protein is going to quickly go away. So it does its job, and then it does not stick around in your body to cause problems over time. So it can't accumulate, it can't hurt you.
As I mentioned, you deliver babies. Have a couple of questions. Will the vaccine affect my fertility? I'm planning to get pregnant in the next few months. Is it safe?
Absolutely. I do think that the vaccine is safe for pregnant people, but, in full transparency, pregnant people were not included in the studies for the phase 3 trials. And so so the Society for Maternal Fetal Medicine and others have come out to say, engage in a shared decision-making discussion with your provider, make sure that you feel good about it and good about its safety. We have no reason to suggest that it would harm fertility, that it would harm pregnancy or lactation based on its biology and how it works, and also based on our knowledge about what is happening to pregnant women when they get sick from COVID-19 infection. So we know on the one hand that they're high risk of getting complications from the infection, and we think very low risk from getting any bad, side effects or harm from the vaccine. So
we've been talking almost an hour, and I want to make sure that we kind of wrap it up and give you some of the facts that we gave at the beginning of the hour. You can always scroll back if you're watching this on replay. But a couple more questions, then we're going to kind of recap where we are today and how you can sign up to be notified when we have vaccine available. Will I get a certificate to prove that I've been vaccinated?
Mm-hmm. Yeah, you get a card, and it has the dates and the type of vaccine you received. Yep.
Well, do you expect that it will be a yearly vaccine like the flu shot?
Yeah, too soon to tell. We just don't know quite yet, but it may be something that requires a repeat immunization from time to time.
And somebody asks, who decides who is high risk based on the medical factors? We have the tiers, and you're basically self-identifying, correct? That you fit into those tiers.
That's right. Yep. We, will not have people looking in a medical record or needing verification, but we do, request that people self-identify based on the state of Missouri's criteria.
So let's go back to the basics of where we are now in delivering the vaccine, when it may be available to others. What's the first thing they really should do? And that's to go fill out our vaccine survey.
Absolutely. Yep. And this allows us to be able to contact you when we have enough vaccine and we're able to get you in specifically, efficiently to get your dose. And so we want to have that ready. And the way that you tell us you're interested is through the survey.
The survey will ask you a few questions about which group you may fall into. It will ask for your email, because that's how we would communicate back with you that your opportunity is up to make an appointment. So this is really the first step. Right now we are giving vaccine, but to what groups?
Right now, this week and next, we're giving vaccine really to complete our 1A efforts. And then, we plan to transition to those next phases here just in the next weeks. I will point out the phase 1A efforts are ongoing. And we don't necessarily need to complete a phase before moving on to the next. So now that they're all active here, 1A, 1B Tier 1, 1B Tier 2 in the state of Missouri, we'll be looking to get those individuals in just as quickly as possible.
But we're missing a critical piece, which is we don't have enough vaccine to invite others to get it yet.
Right. But yep, we're poised to be able to act as soon as we receive vaccine. And so the best action you can do right now, sign up, complete the online form, do be aware aware that this is not something that your doctor is going to be able to give you or your providers in a clinic setting, just because of the unique logistics about the vaccine. So we'll need to set up a different event. That event is indoors and won't be a drive-through event, at least to get us started, just because it's winter in Missouri, and we didn't want that to factor into our ability to give vaccine should we have an icy day.
We had workers that had been in the outside drive-through for the COVID nose swabbing for months, and we now have them inside. It's winter, it's cold, and it's been a great job for them, but kind of thankless when you're closing down and it's raining. So fill out the survey. Self-identify where you fill on the list. We'll notify you when we have vaccine and when you can make an appointment, and then you'll be coming to Faroe Field. And we will be in the days to come showing you where you would be parking, how you would get in the elevator. It will be in the Walsworth Columns Club, which is in the upper level of the stadium, where we'll have the clinic set up for you to get your vaccine, to wait if you choose to before you leave, and run people through them. It's going to be a little different than the drive-through testing, but it's a massive effort and one that MU Healthcare is just really excited to be leading.
Absolutely. And I would point out too that positions have been posted for people to work in those vaccine clinics. So if you have experience, clinically or non-clinically, we need people to register and to be able to do some of the paperwork associated with the vaccine. So, look on our website and lend your expertise there. That'd be great.
Yeah, and you have to appreciate the folks that do step up to do these jobs, because it really is, for many of them, above and beyond their duties. I know you delivered a baby this morning. You're doing a Facebook Live now. You're on the vaccine committee, and we just appreciate your efforts and others who are in direct patient care. My group does communications, which is vital, but we appreciate what you do every day.
Thank you.
Are there any other thoughts you'd like to leave folks with? We've answered a lot of questions, and we expect to do more on our webpage and in future visits. Yeah,
I'd certainly like to take the opportunity to thank the COVID-19 Vaccine Committee as well. They have been hard at work for months. We have been thinking through a lot of logistics, and these are a committed group of people to making sure that this goes off successfully.
Yeah, there's a lot of moving pieces, that's for sure. Okay, well, we hope to see you soon for a vaccine, but it's going to be a marathon, not a sprint.
That's right.
Okay, thank you very much, Dr. Margaret Day.
Thank you.
Associate Professor of Family Medicine at MU Healthcare. And thank you so much for joining us. Please share this Facebook Live if you found it useful to you in learning more about the COVID-19 vaccine. I'm Teresa Snow. Have a great day.